Thank you for joining us, Alan MacFarlane. Are you able to tell us about the progress of NAP8?
Yeah, so NAP8 is going to be focusing on the major complications of regional anaesthesia and other perioperative nerve injuries. So we'll be looking at central neuraxial blocks. This will be the first time that there's been a re-audit of a NAP, because you'll remember NAP3 was done in 2009 on central neuraxial blocks, but we'll also be looking at peripheral nerve blocks as well. And we'll be looking at local anaesthetic infiltration, and we'll be looking at perioperative nerve injury, so peripheral nerve injury and spinal cord injury. So a big topic.
So a big one for NAP8. What sort of patients will be included?
So we'll obviously be looking at adults, children. We'll be looking at blocks in intensive care, all the pain blocks, obstetric blocks clearly. We'll be looking at blocks in the emergency department as well. We'll hopefully be running a separate project with the Royal College of Emergency Physicians, looking at the blocks done by emergency physicians in the ED as well.
Right, and when is it due to start its data collection?
So it's been a huge amount of work so far, still a huge amount to go, but we're hoping to get going in January, February, early 2026 is the plan, if it all goes to plan. So we'll see.
And will it follow the kind of standard NAP methodology of having a kind of data collection to get the patient group, and then how will you identify those that you need to study or follow up further?
So yes, it will follow the traditional NAP methodology. There'll be the baseline surveys. We're working on them at the minute. They'll be late 2025, early 2026. We'll have the full one-year case registry with a bit of prolonged follow-up, because we want to see patients who've got a nerve injury and make sure that that's the time to resolve, if it does resolve. And then we'll have the activity phase in the middle. So yes, it'll be the same standard NAP methodology.
Can I ask a slightly thorny question, which is, if it's complications of regional anaesthesia, what was the rationale behind using general anaesthesia and looking at nerve complications in that?
So if you talk to patients, and we've spoken to patients as part of the NAP8 focus group, then if you come in for an operation and you have a nerve injury, arguably that doesn't necessarily have to happen because of regional anaesthesia. We all know it can happen during general anaesthesia as well, and if you're the patient at the end of the day with a nerve injury, we want to look at that cohort of patients as well, and we might even be able to compare them both. There's a big gap in knowledge. When you look at the data, it's actually 30 to 40 years old now, so this will give us a chance to update all that knowledge.